Meantime, tonight, the leading makers of the COVID-19 vaccine say they are sending the latest shots to hospitals, doctors' offices, and pharmacies across the country.
The FDA approved the new vaccines just as our area is seeing a summer surge in this virus. 10 Tampa Bay's Eric Glasser is here now with more on why health experts say this shot is different from previous vaccines. And Eric, who should consider getting this?
Well, to answer that first question, the CDC is recommending the vaccine for anyone over the age of 6 months. And the reason for that is because the cases that we're seeing now are from variants that few of us likely have immunity from, unless you've very recently been infected.
You know, people get sick, but it seems like there's more people all at once being sick.
Me personally, I know of 2 people. However, I'm starting to hear more people saying be careful because it's coming back around again.
I took a whole week off because my whole family got it when we went on trip.
Hard to find anyone who doesn't know someone who's gotten COVID again this summer. A surge in cases that has Florida bright red on the national map. Wastewater samples showing high concentrations of the virus. And hospital ERs busier than they've been in some time.
Those indicators have been going up for months, and they're peaking right now at levels that we haven't seen since 2020. Bottom line is absolutely go and get it.
Dr. Jill Roberts with USF Health says the newest COVID vaccines have been formulated to protect against the latest, most prevalent variants. If you think you already have immunity, think again.
Yeah, unfortunately, that immunity wanes. And so somewhere between about 3 and 6 months, people don't have protection anymore, whether you've been infected or you've actually been vaccinated. And the main reason for that is that these strains change.
While Roberts recommends everyone gets the shot after consulting with their own physician, it's crucial, she says, for those over 65, immune deficient, or living with comorbidities.
But those are the highest risks, and they definitely should be vaccinated. But I don't want to discount anybody. Anybody can get the shot. They should go ahead and do so.
All right, Eric, got to ask you, did Dr. Roberts give any guidance about booster shots? I know this came up in an earlier conversation this morning with us all.
Right. Some people have gotten booster shots just over the last couple of months. If you've gotten a booster shot, or maybe you had COVID over just the last couple of months, you've probably worked up some immunities at this point. And so anybody that's actually been in that situation probably has some natural immunity. So it's probably safe to wait until the fall, she said, to get the new shot around the same time that you would probably look at getting your flu vaccination.
And Eric, it's been a minute, keeping up with the kids and everything. Is it okay to get those shots at the same time? The flu, the COVID, all of that.
Yeah, Dr. Roberts says if you remember, speaking of the kids, when they got their vaccinations originally, or maybe when you were younger and you got yours, you probably got 4, 5, or 6 of them at the same time. They operate differently, so there's really no concern. In fact, she says that getting one shot might serve as a good reminder to get the other at the same time.
Good information.
Talking about all those shots, it takes me back, sir. Thank you.